now, Plans for Good Health, brought to you exclusively by UnitedHealthcare.
Today, we are taking a closer look at a recent report from the United Health Foundation that details the disparities in health across our country. Our next guest is here to break down these numbers and explain what it means for us here in Louisiana. Please help me welcome Dr. Rhonda Randall, the Chief Medical Officer at UnitedHealthcare and advisor to America's Health Rankings. Thank you for joining us this morning, Doctor.
Thank you for having us.
Yeah, I am so glad that they came out with this report. This is actually the first report ever to be released by them. The name of the report is America's Health Rankings, Health Disparities, and it surveys really all of the states, but Louisiana, of course, is included. Tell me a bit about what some of the findings in the report say for our state.
Well, Louisiana's made some progress in some key areas, and that's great. But we see some areas, like most states, where we still have work to do. Some examples. We saw a 22% decrease in infant mortality among Black infants in Louisiana between the measurement period year starting in 2003 and more recently the period ending in 2018. But there's still work to do here. Black babies continue to die at a rate that's more than double their white, Hispanic, and Asian Pacific counterparts. We also saw a decrease in the Black population who avoided care due to high costs. That's a pretty good jump. It went from 25.9, almost 26% of people avoiding care due to cost to just about 18% of Blacks reporting that they avoided care due to high costs. That's a really big improvement, but still higher than the national average. The national average is 12.5.
Wow. And, even though we have seen some progress in these areas, unfortunately, there is still some work to do. Take a look at this right here. 74% increase in food insecurity.
Right. This comes from survey data done by the national survey that looks at whether or not people are self-reporting that they're worried that they might not have access to food. And in Louisiana, there was a 74% increase, and Hispanics are more than twice as likely as their white counterparts to report that they are worried about food insecurity.
Wow. And on top of that, 40% increase in multiple chronic conditions in female adults at that. And I want to ask you this, doctor, why are we seeing some of these disparities in Louisiana, both the good parts and the bad parts?
Well, we look at 30 different measures across all 50 states. We looked at disparities between race and ethnicity, gender, geography, the states, as well as rural versus urban areas. We also really take a look at educational levels, those who haven't finished high school versus those who have some college education or college degrees. And we see that deep disparities persist in some of these, and in some areas we're making nice progress. Nationally, one of the things that concerns me quite a bit is that we're seeing increases in mental and behavioral health concerns, and those disparities are widening by gender, by levels of education, and even race and ethnicity. It's important to note that this data came before the pandemic. It was reported up to the year 2019. So we expect to see some significant changes as we follow this data over the next several years.
And that's one thing I really found interesting about the report is that data from 2020 wasn't really put in there. That's because you say it wasn't available?
Yeah, so the data that we put in the America's Health Rankings suite of reports comes from dozens of public health agencies, and they report that data in certain timeframes. So the most recent reported data in this report comes from 2019. We will be following the 2020 and 2021 data over the next several years.
And I'm curious, Doc, now that you are bringing us this information about the disparities, both not only in Louisiana, but really as a country, how do we get to a solution? Is there a solution, or we just have to continue to monitor the data to see if maybe things that are being put in place are working?
Well, we really want to see solutions. This report is a call to action, but it all starts with providing that baseline of information so we know where to focus our efforts. Right? Things like maternal mortality, something that's really concerning us. That disparity has continued to plague us as a nation. And in fact, Black mothers experience maternal mortality rates that's 3.5 times higher than their Hispanic counterpart mothers, something that concerns us. So in order to make a difference here, you have have to have that information to start with. And we find that the best solutions come from when individuals, policymakers, healthcare leaders, community officials really come together to focus on a particular challenge.
It really is an interesting report because not only do you see what's happening here in Louisiana, but you can also compare to how we are compared to Florida, Texas, all of the other states. Doctor, thank you so much for joining us this morning and bringing us this information. If you want more information about the health disparities here in Louisiana and across the country, you can check out americashealthrankings.org.